and just understand what your options are. So Erin, thank you so much for being here today and talking to us about this journey of yours and all the personal details of it.
Thank you for having me.
Yeah, of course. So, had you ever heard of urea plasma before you started this journey? Like when you were having your UTI symptoms, had you ever heard of urea plasma?
No, nope. And I want to say first, if you've tuned in and started watching with us, thank you for being here. And if you're not having UTI symptoms, don't let this turn you away. Most women, their only symptom is infertility. For me, it caused me to have the UTI symptoms, but most do not have any except the main reason you may be watching, which is infertility or pregnancy loss.
Right. Yeah. So I think that bears repeating. You can only, I'm going to read what the symptoms of urea plasma are here in a second, but your only symptom can be primary or secondary infertility, right?
Yes. Yes.
Yes. Okay. Louder for the people in the back, right? So, we all know what UTIs feel like. So some of the other symptoms of urea plasma are painful urination, unusual or unpleasant discharge, abnormal vaginal discharge, and lower abdominal pains. But once again, one of the primary and only symptoms can just be infertility. So it's a form of bacteria that kind of gets off track, right? And a lot of people will ask, and I don't know if this was ever a concern for you, Erin, but a lot of people get really worked up that this is some kind of like sexually transmitted disease, or that it is that kind of thing. And that's not the case at all, right?
No, no. But if you have it, your partner is going to get it as well, or vice versa. But you can, whether you got it from a partner, it does not mean they, weren't, what's the word I'm
Faithful.
looking for? Oh,
Yeah. Yeah.
I, you know, many doctors will say urea plasma lives in your body. Everybody has it, but it should not be in the genital tract. So it's a common form of bacteria that can just be in your urinary tract. And for me, I had an IUD. And I think when I had that first
Hmm.
UTI, IUD strain bacteria had got into the genital tract and then caused all this havoc. I've through research have seen that you can get it from a child, from your own kids. So I don't know the exact basis on how if it if it always is in the body, if it's always in the urinary tract, and if it gets to be unbalanced, then you have a problem. I'm not sure, but it's not one that someone was being unfaithful.
Right. Absolutely want to highlight that. So also want to make it crystal clear that this is a very known entity. This is a very known thing in the reproductive community, the reproductive endocrinologist doctors community, that it's known and linked to reproductive disease and conditions, right? Also known as infertility. So this isn't some like super rare off the wall, you know, nobody knows about it. I mean, a lot of people don't know about it, but that doesn't mean that it's not common, right? So if
Yes.
you leave it untreated also, and you get pregnant, if you happen to get pregnant, then it can also cause miscarriages at any stage. Early, you can have a miscarriage late, because you can spread it to your baby. You can also, if left untreated, can cause disease in other parts of your body. So, like Erin mentioned, your partner needs to be treated, and we'll get into her story here in just a minute, but you and your partner need to be treated. So speaking of that, Erin, you were treated early on with like a broad spectrum antibiotic, right? In this journey.
Yep. So I work for high risk OBGYN specializing in maternal medicine. I have worked there and been in that career for over 15 years. I'm an ultrasound tech. Trust the doctors that I work with very, very, very highly. I had started telling one of them about my story and what was going on and my symptoms. And they had called the OB-GYN who I saw at the time and said, you test her for everything. No, she did not test me for urea plasma. Sorry, are those notifications popping up for you on my
They're
phone?
not. Nope,
Okay.
I don't see
Um,
anything.
she did not test me for urea plasma. She tested me for, every STD, bacterial vaginosis, all kinds of things that could cause burning. Of course, UTIs, everything was negative. So the doctor I worked for said, call her in doxycycline. Let's just knock whatever this is. If it's atypical, knock it out. Just do a round of doxycycline. Well, not knowing what it was, they did prescribe me doxycycline, not my husband. My
Mhm.
symptoms, now not the symptom of infertility, but the symptoms of what felt like a UTI got better for about 2 months, and they came right back. He was never treated, so he still had that bacteria in his genital tract as well.
Right. So this is the very beginning of your journey, and you went to, can you name all the different kinds of doctors that they ended up sending you to? You went to what, a
Yeah,
urologist?
I started with my OB-GYN, and
Yep.
then she kept telling me it sounds urinary, so she sent me to a urologist. That urologist pretty much dismissed me and told me to change my diet, which was things I was already trying. They were thinking maybe it was interstitial cystitis, and I had read
Mhm.
up on that interstitial cystitis and had already done things with my diet to try to make that better. And they did not test me for that. They just said, "I think it's this." So I then went to see a urogen, a urologist specializing in women's gynecology as well,
Mhm.
and they scope and they took a clean catch urine. They said, "You don't have a UTI." The scope did not show interstitial cystitis. My bladder was completely normal.
Mhm.
Um, that was, the end of my journey with the urologist. So then I finally was referred to my first REI because we were a year trying to get pregnant. We
This is
had
doctor
had,
number 4, if you're counting.
yes, one early loss, very early. Like I had a positive pregnancy test. The line just faded away. It's like a
Mhm.
chemical or implantation problem. So my OB-GYN, so that first doctor, she did a hysterosalpingogram to make sure my tubes were clear. She also ordered an ultrasound, which I knew was going to be fine because that's what I specialize in. Ultrasound was normal. HSG was normal. She then sent my husband to have a semen analysis. His morphology was 3, but everything else was normal. And if I jump to real quick where I said his morphology was 3, urea plasma also affects sperm health, sperm shape. They cannot swim as well. So I think that was a huge aspect as to why his morphology was 3. My OB-GYN then said, you need to see an REI because of the low morphology. I don't want to put you on Femara or Clomid and not have the best that you may need. So I
Right.
started with my first REI. That was when I had another miscarriage before I even saw them. Had a positive
Mhm.
pregnancy test. We don't need to see them. We're fine. The line just faded away. So I'm telling them at our appointment all my symptoms, my history. I was 34 then, probably. My
Mhm.
cycles were 30 days, but I conceived my first baby with that same length of a cycle naturally. They said I needed to do IUI to have the best outcome due to his morphology. And they put me on letrozole to help me ovulate sooner or more optimal. They did tons of testing, all the blood work, hormone levels, everything was normal. Nothing else other than low morphology, and I ovulated late. And this burning UTI symptom
Yeah. So I
that
just
they
want you to pause right there. Right. This
yes.
burning UTI symptom. So the thing that I want to point back to is you're relatively young. You have already given birth without any assistance to your first daughter. And now all of these things have been brought up to you that this is a problem, your husband's sperm motility, right? And now your ovulation is being called into question because it's different than what, the doctors think that it needs to be, right? But your
Mhm.
hormone levels were normal. So now we
Yes.
have this unexplained infertility diagnosis.
Yes.
Right.
Yes. They said yes.
We're not looking, in other words, what I'm trying to say is we're not looking at hormone levels that are out of whack and your ovulation is potentially late. This is just the doctors, we don't know what else to do, basically, right? So
Yes.
we're going to try to control an earlier ovulation so that they can do the IUI. Okay. So,
Mhm. Yep. So before I started letrozole, there was another miscarriage, and there was like back to back almost. I had two more early losses. So as we're gearing up to do our first IUI, I'm on letrozole, a low dose, like whatever they start you at
mhm.
low. I also want to say this was in 2019.
Yeah. And
So
again, I just want to pause you because you're getting pregnant. So your
yes.
ovulation's not broken, right? Because
Hmm.
you're getting
Right.
pregnant. The sperm are making it. You're getting positive pregnancy test, right? So these are the kind of things. And I'm so sorry. I know that you're like on a roll and I want to hear your story, but I want
Yeah.
our
Yeah.
listeners to understand that like this is not logical.
Mhm.
She does not have symptoms of poor ovulation. She's getting pregnant. She's not staying pregnant. Why isn't she staying pregnant? That's the question that needed to be asked right then. Wouldn't you agree? Why am I not keeping these pregnancies?
Yes.
Right. Okay.
Yep. So in my mind, I'm thinking I have an infection. My body's in fight mode. My body's fighting off these pregnancies. I'm not even getting past implantation.
Right.
So we go to do the IUI, and I want to be trustful of the REI because they're the specialist.
Yeah.
They should have tested me for everything basic, right? They should have tested me. They should have looked more into my history, my symptoms, but they're the specialist, and they are an office that the doctors I've worked for 15 years refer patients to. So in my mind, I need to trust the specialist. So we do the first IUI. It was not successful. We did 3 IUIs, not successful. Now, during those 3 IUIs, I mean, here I am now. Once the IUI journey started, I'm not getting pregnant at all. That stopped. So there was something going on that I need to talk about here too, as to why IUI as well wasn't working, but is a blessing that it wasn't working.
Yeah.
So each IUI cycle, they increased my letrozole, and I was having great follicles, beautiful follicles, over 20 millimeters, like right when I should be getting ready to ovulate. Everything was timed right. Everything seemed to be working, but the IUIs were not working. After the third IUI, they said, "Oh, we need to test you to see if your natural killer cells are elevated." And I'm like, that was not done yet. And you just had me do 3 IUIs and you did not check my natural killer cells. So, natural killer cells are something that's in our body that elevate when there's an infection, which
Hmm.
does in fight mode and wants to fight anything foreign that comes into your body, like a pregnancy.
Right.
So, I was like, oh, that's great because, yeah, I probably do have that. And those were elevated. So, they then wanted to put me on a steroid. After ovulation, they then wanted the steroid to come in to suppress the natural killer cells to let
Hmm.
implant. So here I'm on a steroid now. My blood pressure is going up. Steroids are not healthy. They're not good for blood pressure.
Yeah.
They were going to keep me on the steroid if I got pregnant throughout the whole first trimester. So at that fourth IUI, I noticed, and they're letting me do more IUIs because they missed testing me for natural killer cells. So now they're like,
Hmm.
we have a steroid. Let's do, a couple more IUIs.
Yeah.
The IUI, I noticed that my endometrium, the lining of my uterus, was really thin when I had beautiful 20 plus millimeter follicles gearing up for ovulation. My lining was 5 millimeters. And my training, and through at this point, the 12 years I had been doing my career in OBGYN
You're
ultrasound,
seeing this every day, right?
I
You're
see
seeing
every day.
uterine linings every day.
Yes. And we did follicle studies there as well. I knew that my lining was thin. And I questioned them. I said, my lining is only 5 millimeters. Right before ovulation, it should be 8 to 10, even more than 10 to have successful implantation. They blew me off. They said, no, like we see women get pregnant all the time with 5 millimeter linings. Thinner women can have thinner linings. Okay, well, that was never
That's not
ever.
your normal, right? And
And what we
that's not your normal, right?
right. So I trusted them. I did another IUI, it didn't work. The fifth, I trust, I don't know why. I don't know why. I trusted them for a fifth IUI with a lining of 5 millimeters. And this is just, so we did a fifth IUI, didn't work. Gearing up for the last one, I said, I'm not doing an IUI, my lining's too thin. And they said, oh, we'll throw in some estrase. I think that's a form of estrogen that can help thicken the lining.
Mm-hmm.
And that, I mean, that did nothing, but I didn't do an IUI. We just did intercourse and put the estrase, did the estrase. And my REI at that first office had left, went to another office, which kind of, that scared me. And that was also a red flag as well. He was a very successful infertility doctor who had worked for a different practice and then came to work for this one. And he was only there for like 10 months and left to go somewhere else. So I then sat down with another REI that is in their office, and he is like the owner. So he's like the REI, and he had all my history there. I told him again, I'm having this burning. I'm not getting pregnant. I think it's related. No, it's not related. We can't offer. And then I told him about the lining. I don't like how thin my lining's been. At that point, I can't offer you any more IUIs. There's no other medication you can take. You need IVF. Showed me this graph. You are 78% chance that you're gonna have a successful IVF. At this point, I had a consult with another fertility office about an hour away.
So before we move on to the second opinion, I just want to speak to the women out there. I have a little bit different journey than yours, but I want to just highlight something that I think is common amongst anybody going through infertility, and that is the desperation. You said, I don't know why I agreed to this, right? I don't know why I agreed to that third, fourth, fifth. How many was it?
Right. Three more.
Yeah, three more with a thinner lining. So I just encourage you, if you're listening, and I think Erin would agree with me, to pause when you have those stirrings in your, however you want to say it, in your gut, that inspiration, that feeling that like something's not right. This is not working. This is not logical. Don't just dismiss that, right? Like, do you have regrets about just continuing to do that?
I do. Yeah, I have regrets. And then a lot of times I tell myself my babies wouldn't be who they are if I didn't. So, but yes, it was harmful to my body. It was harmful to my marriage, our bank account, our
I was
job.
going to say, and there's no refunds, right? There's no refunds for those 3 IUIs that they did, and your lining was way too thin, right? So I think it's really important, to trust yourself. You have to believe in yourself, right?
Absolutely.
So this doctor does not talk you into IVF.
No, so my daughter at home was 3, and I'm thinking, I started trying when she was 1.5. What changed in a year and a half? Not that much could have changed. Like, this is not, the IVF was not an option for us either. There was no insurance coverage for fertility, and not knowing that it was going to work, and me knowing my body doesn't feel right.
Yeah.
I can't do this. So I had the appointment made with another REI's office, and one of my friends who went through infertility around the time of my third IUI, she was like, why don't you go get a second opinion? She said something right. So she caught on much earlier than I had. So it's just hard when you think I'm at a place, they've been with me now for so many
Yeah.
cycles. They've got to know more about me. We've got to be getting closer. And we
You
were
get
just
really
getting,
invested in the process, right?
we
You
do,
know,
yeah.
just one more, it'll work this next time. And you might not be getting personalized care, or you might not be really, comfortable with what's going on, but the known is better than the unknown, right? So we
Right.
kind of stay where we're comfortable. And um, I think that the industry makes it easy for women to do that too, right?
Mhm. Yes. And, back to the lining, what that wasn't working for me. I wasn't
Mhm.
getting pregnant with millimeter lining. So why didn't we change something
Right,
in the process? Now that wasn't the main problem, but that wasn't helping,
right.
that was kind of, I think,
Yeah,
God protecting what needed to be done first. But
right.
so
So we go for your second opinion.
yes, before that, I changed my OB-GYN. So I had a new OB-GYN come in who had a background in infertility.
Hmm.
He was 70s and he used to practice infertility, but as he got older, he scaled down to just doing OB-GYN. He
Hmm.
delivered my daughter because he took call from my doctor, but he had his own practice. So I
Gotcha.
had started seeing him and talking to him about my history, and he had brought up this doctor I was getting my second opinion with. He said, "Why don't you see him? I trust him." And so I went to see him, and I took everything to him, all my ultrasounds, my history, my lab work, of course. The first thing he said when he reviewed the images before that, before the IUIs, the ovulation time when they did an ultrasound, he said, "Your lining was too thin for any of these IUIs. I would not have done one of them." He said,
Oh,
maybe he said, "What surprises me is they just kept increasing the letrozole. They didn't change anything in your protocol except increase the letrozole. Well, the letrozole was having you ovulate too soon. Your lining didn't have time to catch up and build up to be ready to sustain a pregnancy." I truly believe that first office did not want me. They wanted me to do IVF. They wanted me to believe
right,
I needed. They know better. I knew better. I knew that
right.
lining was too.
Yeah.
Clomid can also do this. I think Clomid's more common to do this to your lining, but
Hmm.
letrozole can. Now I asked that first RUI or the other office if there was any other medication I could take. They said no. You need IVF. My second opinion at the new REI's office, he said, "I want to try tamoxifen. Tamoxifen can help with ovulation, but it also helps to thicken the lining. It doesn't have that negative effect for your lining." And I said, "Okay." And I said, "I want to just do timed intercourse, though. I'm not ready to do IUIs." Um, I had left his office, and it was right around that time. I had done some research online and found through a blog, infertility Facebook page, thankful to other women who tell their story.
Yeah.
A woman wrote, "I had this infection and they won't check you for it unless you ask. I was treated and I got pregnant." I'm actually friends with her on Facebook because I reached out to her and thanked her
Hmm.
because she said it was urea plasma. And tons of women started commenting, "I had this too. I got
Yeah.
pregnant once treated." So I then searched and started researching urea plasma. What is this? How do you get it? Well, how do you treat it? Um, I came across another woman's story. She wrote an article and her story was similar to mine. She had been gearing up, getting ready to do IVF, and she met with an acupuncturist who told her, you might have urea plasma. And
Hmm.
I don't come of her journey. I've tried to find her. I haven't been able to find her,
Yeah.
but symptoms were my symptoms, her everything. And I knew, and I cried because I knew in that moment, this is it. This is it. And it's not anything else. So I called the new REI and I said, "I think I have this. Can you test me?" And the nurse said, "Oh," she's like, "if you think you have that, you need treated, but I don't know if we can test for this." And I was like, "Okay." And she's like, "I'm going to talk to your doctor and I'm going to call you back."
Hmm.
And she called back in a few hours and she said, "It is better just to treat you for it than try to test and diagnose. She said it's very hard to diagnose it. So we're calling you an antibiotic. It was azithromycin.
Mm-hmm.
Oh, they did not call it in for my husband. And this is another part where I'm like, did they want me to believe I was fully treated? And we just dismiss it all?
Mm-hmm.
So I got my azithromycin. I then called my new OB-GYN
Mm-hmm.
who I had seen him in my field of work, how he interacts with patients. And he's old school. I mean, he's older and he, the way he used to practice is different than how most offices practice now.
Yeah.
And I,
Probably takes a little bit more time with his patients, right?
yes. Oh, absolutely. Yes.
Yeah.
And he couldn't believe some of my journey so far as we had talked about things,
Yeah.
but I was mainly working with the fertility office, and I think he maybe thought that they had done the things they were supposed to do or the way things used to be practiced. I'm not sure, but his nurse called. I talked to his nurse and she called me back. She wanted to talk to him. And she said, yes, he can test you, but he said you should have been tested for that in the beginning of your journey when you had trouble conceiving. So 2 years ago, you should have been tested for this. And I wasn't, of course. So she said, and I need to schedule you at ovulation, and you need to have intercourse 4 hours prior to ovulation, or 4 hours prior to your
Appointment.
with us.
Right.
And she said, we're going to do a post-coital test. So I went into the office, normal OB-GYN office. I wasn't going to have surgery. We had intercourse, and my doctor took a swab of cervical mucus,
Mm-hmm.
and he went to look under the microscope, and he came back in and he said, you have great cervical mucus, but it's filled with white blood cells. And I said, what does that mean? And he said, mycoplasma, urea plasma infection. He said, I would send this to the lab, but there's no reason to. He said, it may not even grow on lab, but I know that when a woman has a lot of white blood cells in her mucus, that she has mycoplasma or urea plasma infection. He said he could see the sperm under the scope, not able to swim through that mucus because of the cells, and that they just swam around like they couldn't get anywhere. He said, if they had gotten to the egg, it wouldn't fertilize well.
Mm-hmm.
The other problem, those early, before we were doing IUIs, I kept having those early losses because I had no lining. My lining back before IUIs was normal. So
Say that again.
My lining before IUI was normal. Yep. And I, being an ultrasound tech, this was something that I could watch, and I knew that it was 10 to 12 the time of ovulation, but when I was under the IUI care on letrozole, it was 5.
Yeah.
So my doctor said, I'll treat, azithromycin will work for this, but your husband needs treated too, or you're going to get it right back.
Okay. So let's put a pause here.
Mm-hmm.
You have a new OB-GYN and you have a new reproductive endocrinologist.
Yes.
Your reproductive endocrinologist, your specialist, only wanted to treat you.
Mm-hmm.
It took somebody, said nothing about your husband. So this is a super important point. It took your OB-GYN, your new one, taking the time, doing that postcoital test, and looking at the cervical mucus under the microscope in order to get this diagnosis, and then he treated your husband.
Yeah, he had to go to his primary because my husband wasn't a
patient,
but
of course.
this is what yes.
Yeah.
So because he said you can keep trying, you're fine to get pregnant on azithromycin. If azithromycin doesn't work, then we need to try doxycycline, but you cannot conceive on doxycycline.
Right.
So, but back to the, when I was diagnosed in his office, he said, I have been doing this for a long, long time and helping tons of couples who have struggled with infertility get pregnant because I have diagnosed this infection in them. He said it's a $10 antibiotic. And I think my jaw probably dropped down to my feet because I was just shocked that I didn't have to have a surgery to diagnose this. He did it in a couple minutes in his office. He didn't even have to send it out to the lab. He told me that, urea plasma usually will not even grow in lab if it does,
Mhm.
or it takes time. So I said,
Say that
why?
again, Erin.
He told me in the sending that off to lab that urea plasma can take a very long time to grow in a lab, if it
Mhm.
even does.
So you might
Um,
have to advocate for yourself with your doctor who insists on growing this or culturing this sample, right? If they swab you, they want to send it off to culture. You know your body. You might have to say to that doctor, I don't care if it grows or not. Like I have all these symptoms and I'm going through infertility. So, you might have to go someplace else. You might have to get a second opinion or something like that. But don't dismiss the fact of how you
yeah,
feel and your symptoms just because it doesn't culture.
right. Yes. And so I've talked to several women, one being my cousin's wife, and I'm going to tell you about her story in a minute. Um, I hope things are better now. It's been, 4 or 5 years, and maybe the labs, maybe things are a little bit better and how they're
Hmm.
picking it up. But I asked my OB-GYN, I said, why was I never tested for this? And he said, I hate to say that the medical industry has turned to this, but a $10 antibiotic doesn't pay the bills.
Hmm.
$25 IVF pays the bills. And he knew that this is being dismissed by the fertility industry or not treated properly by the fertility industry.
Right. So I just want to say too, women come to me all the time with questions and we talk about what testing they've had and everyone wants to believe in their hearts that they have been tested for everything. And I have not worked with one single client that has been tested for every single thing. There's always gaps in care, in coverage. And I think Erin's story is like such a great example of that, of her new doctor assuming and making the assumption that this is something that had been tested for earlier in her infertility journey. And it just goes to my point of you have to take charge of your medical records, of your infertility records, of knowing you have to know what you've been tested for. Should it be that way? It shouldn't. Do you want results? If you
Mhm.
do, you're going to have to take responsibility for it. I mean, that's
Yeah.
literally all there is to it. And people that feel very uncomfortable with that, um, we're not talking about, being super aggressive with your doctor or whatever, but you should be able to get collaborative care, you know.
Yeah.
Um, and nobody knows their body better than you do.
Yes. No, that's definitely true. And I tell women a lot, tell them I'm your friend. Say my friend went through this and this is what
Mhm.
she needed. Um,
Right.
so we did end up conceiving our daughter. Uh, it was very shortly after that. So we did not need doxycycline. We both just needed azithromycin, and we had successful implantation. Now I was still doing tamoxifen and timed intercourse, but that was it.
Hmm.
So I did have an on board, but again, my lining wasn't a problem without
Right.
electrical.
Right.
So my cousin's wife reached out to me, and they had trouble having their second baby, and she wanted to know more of my story. She was getting ready to see a fertility doctor. They had dismissed anything about urea plasma as well. She went back to her regular OB-GYN and said, I want tested for urea plasma. And she said, there's millions of women walking around with urea plasma. It's fine. It's not the reason why you're not getting pregnant. She didn't have any other symptoms. Her only symptom was infertility.
Hmm.
I wanted to be like, are those other women walking around trying to get pregnant, or are they all the women out there with unexplained infertility?
Right.
So my cousin said, I want tested. She tested her, but the way she tested her, she didn't tell her in the office. She did send it to a lab, and
Hmm.
it did up urea plasma. And this was last year. So maybe that's gotten better. I don't know. I
Yeah.
don't know. But her doctor was not going to treat her. Said, no, that's not the reason. Like, you don't need to be treated for this. And she said, I want treated. I want you to treat me. And so
Hmm.
she was cycling, her and her husband both. He had to go to his primary doctor. They both had a round of doxycycline. 6 weeks later, they got pregnant.
Wow.
Healthy pregnancy. Um, I know of another woman who's reached out who had success after treatment as well, after having early
Mhm.
losses, years
Right.
of infertility. And something I've also thought about, and I've heard of people having this, and then I actually saw it on a Friends episode when Monica was trying to get pregnant, and they told her she had a hostile environment. And I've heard of people saying they have been told that they have this hostile environment and they're not going to
Right.
be able to connect. And I'm like, was that the white blood cells? Like, did they do that
Right.
test back to scale those white blood cells and not understand the
Yeah.
meaning of that? It
Yeah.
always makes me wonder. I don't know.
The post-coital test and right. Well, I think that the bottom line is advocacy. Do you feel like self-advocacy, do you feel like if you had been tested, like done the post-coital test earlier, that you would have the whole journey would have been shortened?
Yes, I do. So we conceived our second very quickly. And then after treatment,
Hmm.
I was, she was 8 months old. I was exclusively breastfeeding her. And we conceived our third. About when our third was, she was close to 2. We got pregnant without trying. Didn't know we were pregnant. That was actually a miscarriage, but we had done testing. It was trisomy 15. It's as your age goes up, you can be at more of a risk for some of those chromosomes.
Chromosomal. Yeah.
They did the testing and they did confirm that that was from my egg. And then after I had a DNC for that pregnancy, we conceived our fourth baby easily, no medications, no tamoxifen. I just think that's not coincidence. Three, conceiving 3 healthy pregnancies so easily after going through that wicked journey to get our number 2. It's not
Yeah.
coincidence that that was urea plasma. I mean, it was urea plasma. It didn't just happen.
Absolutely. Right. So if you're watching this episode and you've gotten to this point, and this has helped you in any way, I know Erin would especially appreciate it. I would especially appreciate any kind of comment or feedback if you find yourself in this situation. If you have questions, I know that we're both here, to help you in any way that we can. But Erin, I'm sorry for that loss. I want to say that a loss at any stage is a loss, and for any reason, it's still super painful. So I'm sorry for that, and I'm really sorry that you um, had to go through this terrible journey to get to get to this point. But I so appreciate your passion, your advocacy, and Erin and I are friends on Facebook now, and I get to see her beautiful, darling little girls. Who are just as beautiful as their mama. So thank you for being on here today. Is there anything that you didn't get to say that you want to say before we go?
Yes, in my career, I see a lot more pregnancies now resulting in IVF, a lot more. And whether that's just the way things are now, women are older trying to get pregnant, or just people are jumping to IVF, I don't know. But there's been something that we kind of see frequently, that a woman did IVF, she comes in for a 20-week anatomy scan, and she doesn't have any cervix or much cervix at all. And they have to be tested to see if this was a bacterial thing that's caused inflammation of her cervix to then shorten and not want to sustain the pregnancy, or if they can put a stitch in the cervix to help the woman and help hold her cervix till get to term or more further
Hmm.
along. And I've
Yeah.
asked our doctors, those women who have a bacteria, do we know what bacteria it is? And they say, no, we don't know. And one of them said, it makes me wonder if it's the reason for the infertility in the first place.
Hmm.
BF is bypassing some of this.
Right.
And bacteria is causing an inflammation that is not good for your body or
Right.
your cervix pregnancy. So I really urge, this to be ruled out, even
Yeah,
if you don't
because
have it.
right. I appreciate that so much because just doing my research for the show today, it can cause joint inflammation. It can move to other parts of your body if left untreated. But say you don't have the symptom of the shortening cervix and you do IVF and you don't have the shortening symptom of the cervix shortening, you can still miscarry your baby. Like your baby can die in utero. It's terrible. Like the bacteria can kill your baby. So, just dismissing this as something that is not affecting you because you're doing IVF or that, because you have gotten pregnant, it's super important to pay attention to your symptoms and, ask for this test. I mean, it's a super, super easy treatment. Um,
Mhm.
so agree or disagree?
Oh, yes, agree.
Yeah.
Yes, for mycin, they prescribe that for and I've had some women say, surely they would know if I had this by now. And I'm like, no.
Right. Right.
Or they're only treating the woman. And I'm like,
Yes.
no, like, why put yourself through that and want to chance that rather than just have husband get treated too, or your partner that way? That do you know it's cleared? And
Right.
I've been tested for urea plasma since then. They did not test the way. So my OB-GYN did retire. My miracle doctor, he retired. And but I did have a doctor who I went to that I transferred to who trained with him closely, and she didn't test the way he did. She did send it to lab and it said I didn't have it, which I mean I haven't had symptoms, but
Right.
it still scares me.
An abundance of caution. Yeah. Um,
Yeah.
so thank you so much, Erin, for having us, for being with us today, for sharing your story, for being passionate and, for just, trying to help others. So, I appreciate it so much.
Thank you.
Right.
And I'm wishing everyone lots of hope and success and
Absolutely.
just advocate as much as you can.
100%. All right. Have a good